Sometimes constipation becomes a problem, and the other time, the opposite, diarrhea becomes a problem. Diarrhea is a condition which involves frequent passage of watery and loose stools. It comes from the Greek word diarrhea, that means dia means flow and rhea means through. The factors that can lead to passage of unformed stools are infections, drugs, foods, and diseases. People of all ages can get diarrhea, but it is very common in children below 5 years of age. Children with the poor nutritional status and living in unhygienic conditions are more prone to diarrhea and dehydration than the healthy children. There are three clinical types of diarrhea. One is acute watery stools, where there is passage of loose stools without blood or vomiting or fever. If it occurs for more than 14 days, it is called persistent diarrhea. Dysentery is passage of blood in the stools, and this is caused because of the Shigella, Salmonella, and Entamoeba histolytica. Then chronic diarrhea, there is recurrent and long lasting diarrhea without any cause of infection or any other reason. Causes may be inflammatory disease, fungal, bacterial, or viral, medications, and consumption of too much of sugars, damaged mucosal surface, all these leading to malnutrition. There are different types of diarrhea. One is secretive diarrhea, where there is loss of chloride into the bowel, and because of this, more and more water is absorbed into the bowel and leads to diarrhea. Example is cholera. Exudative diarrhea is where there is damage to the intestinal mucosa, and the mucus, blood, and lining of the intestines are excreted through the stools. This is mostly present in ulcerative colitis. Then infectious diarrhea caused either by fungi, bacteria, virus, or parasites. Motility related diarrhea, where the motility of the intestines is very fast, the food remains very less time in the intestines, and the less nutrients are absorbed, and water is also not absorbed, therefore leading to diarrhea. Treatment will be identifying the underlying cause, fluid and electrolyte replacement, broths and electrolytes rich in sodium and potassium, pectin, which is present in apple and bananas, can be given. Avoid caffeine. Then oral rehydration solution